The benefits of yoga and the addition of yoga to rebound sports and physical therapy. The practice of yoga has been proven to help with many types of physical injuries, as well as mental and spiritual instability and overall balance, strength, and flexibility. Physical therapists have many different techniques they use for rehabilitation for patients, but most of them leave out the aspect of practicing yoga. Rebound sports and physical therapy should add yoga to their rehabilitation program to increase their success with the physical health of their patients, to grow their business, and to obtain a better sense of accomplishment with their patients. The addition of yoga would not only be beneficial to the physical therapist, but would also benefit the patients receiving the therapy. It could also be favorable for the physical therapist to participate in yoga to get the full experience and to observe what postures are most beneficial for certain injuries that patients come to them with. To begin, individuals who have had a stroke have a high tendency to obtain physical therapy to help them lower their incidence rate of falling and further hurting themselves. In a journal written by Nancy Selfridge, a doctor of medicine and a professor at Ross University School of Medicine in Wisconsin, it is stated that persistent balance, strength, and sensory deficits are the underlying factors associated with increased risk of falling after a stroke. Although many of the exercises that physical therapists will give these patients will help a great deal, yoga is a type of therapy that specifically focuses on bettering balance and strength in individuals. In a study done by Langhorne et al., postures were chosen and taught by a registered yoga therapist with input from the research team based on previous evidence supporting improved balance through a focus on increased hip and ankle flexibility as well as strength. Such postures include half pigeon for hip flexibility and tree pose for hip and ankle strength as well as balance. In this study, many of the yoga participants acquired an improvement in balance enough to diminish their increased risk of falling. With such a high improvement rate of balance in these individuals, it would benefit physical therapists to add this to their practice to increase their rate of success and to obtain a greater sense of accomplishment with their patients' improvements with their setbacks caused by stroke. Secondly, the practice of yoga enhances walking and balance, muscle strength, cardiovascular health, blood pressure, sleep, and functioning of other systems, according to an article written by Neela Patel, who is a doctor of medicine and a master of public health, Ann Newstead, who happens to be a physical therapist, and Robert Ferrer, who is also a doctor of medicine and master of public health. In this article, the focus is on the effects of yoga in older adults who tend to have more aches and pains due to their age that need therapy to diminish. An emerging evidence base describes the effectiveness of yoga for psychosocial and physical functioning in older adults. It was found that balance, strength, and flexibility improved with yoga, but cognitive functioning did not. With the author Ann Newstead being a physical therapist herself, my argument that adding yoga to rebound sports and physical therapy's practice becomes more credible with this source and proves that yoga can be a beneficial form of therapy. Furthermore, in an article called Yoga and Sports Injuries written by Philip Langeris, it says you can supplement your rehabilitation regimen with yoga to decrease recovery time. Props such as pillows and chairs allow you to modify those poses to accommodate your injury, thus allowing you to target the afflicted area without risking further injury. Recovery time is usually one of the most irritating things to deal with for injured athletes that just want to get back into the game. With decreased recovery time through yoga, patients have the opportunity to be more satisfied with their physical therapist, creating a better review for the therapist and the possibility of the patient referring their teammates, who may also have an injury, to this therapist. Another statement made in this article is that yoga chiefly promotes flexibility, but other benefits include increased strength, reduced chronic pain, headaches, and lower back and musculoskeletal problems. Consult a doctor or physical therapist before supplementing your current rehabilitation regimen with yoga. Due to the fact that this article specifically says to consult a physical therapist, it is clear that there are some physical therapy facilities that do in fact use yoga as a supplement to their practice, meaning it would benefit rebound sports and physical therapy to do so to create less of a gap with their competing facilities. Also, with rebound specifically working with sports injuries, this article is relevant in showing that yoga therapy is beneficial in healing sports injuries and would be beneficial to their practice. For rebound sports and physical therapy to take my argument into consideration, an actual example of yoga healing an individual with a severe or minor injury could drastically help my cause. This brings me to talk about Bikram Choudhury, who happens to be the founder of Bikram's Yoga as well as a lifelong athlete. When Bikram was 17 years old, He injured his knee in a weightlifting accident to the extent that it was thought that he'd never walk again. However, with only 6 months of practicing yoga, Bikram was considered to be totally recovered and returned to his normal daily activities as well as the continuation of yoga. This live model of yoga being effective in healing a serious injury shows that yoga could be a very beneficial technique of therapy for rebound sports and physical therapy to use, considering that most of their patients come to them with a severe injury. Adjacently, a video posted on YouTube within the last 6 months called The Amazing Transformation of a Guy Who Didn't Give Up shows the incredible healing powers of yoga. This video stars a 47-year-old disabled veteran who was injured as a paratrooper in the Gulf War due to all the jumps he had taken while in action. He was required to wear a back brace, knee braces, and had to use crutches to help him walk. He couldn't walk or run, and for 15 years, doctors told this man that he would never walk unassisted again. As with anyone hearing discouraging feedback, this news had driven him to basically give up until one yoga instructor, Diamond Dallas Page, took on the challenge to help this man. With the help of this instructor, this man was not only able to walk without assistance again, but after 6 months of this yoga training, he was also able to run again. This inspirational story should be enough proof in itself that yoga is truly beneficial in healing serious injuries and can bring miracles to some individuals. Rebound Sports and Physical Therapy should take this man into consideration and add yoga to their practice, to add variety to the types of patients they are able to work with, and to obtain the opportunity to create a miracle for any patient that may be similar to this man. To conclude my argument, I will say that there is really no downside to the addition of yoga to Rebound Sports and Physical Therapy's practice. It is a fast-growing phenomenon, and my sources have shown that evidence about yoga's improvement with mental and spiritual instability and overall balance, strength, and flexibility is in fact true. The addition of yoga to this facility's practice would help increase their success rate with the health of their patients, help grow their business, and obtain a better sense of accomplishment with their patients. If Rebound Sports and Physical Therapy added yoga to their therapy techniques, they could gain the upper hand on their competitors in the physical therapy industry and create the opportunity to gain more patients that they may not attract without the addition of yoga. In the long run, this addition would be beneficial for this facility, and it should be highly considered.
Down below, where you